Well, Dr. Limakatso Lebina is the Director for Clinical Trials at the Africa Health Research Institute. She joins us now via video link. Dr. Lebina, very good evening to you. Thank you so much for joining us and a warm welcome to the late edition.
Thank you, and thank you for the invitation.
Now, we've seen Minister Dr. Aaron Motsoaledi describing the arrival of a TB vaccine as freedom from slavery. Now, from a clinical research perspective, what makes this vaccine so revolutionary compared to existing TB prevention and treatment interventions?
Yeah, maybe just to start off to say that TB continues to be a major public health problem in the world and in South Africa. TB is a leading cause of death from a single infectious agent. Based on the World Health Organization reports from 2023, about 10.3 million people were diagnosed with TB in 2023. And in South Africa alone, we had 270,000 people reported to have started TB treatment. So that shows the magnitude of the problem. And our incidence in South Africa is about 3 times higher than the world average. And we know that getting a disease, treating it, it's costly, not just to the person affected, but to their family and to the health system and the economy as a whole. So if we can prevent more people getting TB, more people having to take TB treatment and more people dying from TB, it will be a big win if this TB vaccine actually works and it's adopted and rolled out in countries that have a high burden of TB like South Africa.
And what stage is the leading TB vaccine candidate currently at the clinical trials pipeline? And maybe you can just talk about some of the major hurdles that remain before approval and rollout.
Yes, it's taken us a long time. The BCG vaccine that was just talked about, it was approved more than 100 years ago. And it works. We still encourage people to take it. It's given to newborn babies in hospitals. But it does not work so well to prevent lung infection in adolescents and adults. So the quest now has been to find a TB vaccine that can prevent TB lung disease, especially in adolescents and adults. There's currently about 15 molecules or products being evaluated at various stages of clinical trials. 8 of those are currently enrolling in clinical trials or data expected in the next couple of years. And I think as a country, as South Africa, we need to be proud that we have been at the forefront of evaluating these tools or these vaccines as we need them the most, as one of the countries with a high burden of TB. So most of them are enrolling. We have about 3 that are very promising. The M72 TB vaccine, which is fully enrolled, the 20,000 people, and we're expecting the results in about 2028, 2029. We have a messenger RNA TB vaccine that also came from the lessons from COVID-19 that is still in the earlier phases of clinical trials, but it's also promising. We have MTB-VEC, which is a live attenuated or a genetically modified TB vaccine that is also on later phases of clinical trials. So based on the current work in clinical trials, we expect that we should have at least 1 novel TB vaccine by 2029. I cannot say for sure which one it will be, but we have a few candidates. Yeah.
Now, Dr. Lebina, earlier on, you just spoke of the need for South Africa to be proud at being at the forefront of, evaluating such a vaccine. But then what vaccine preparedness does it entail for South Africa and the continent? And maybe let's talk about the role that your institution is playing insofar as ensuring readiness for rollout once approval is granted.
So many countries, including South Africa, we have a strong vaccination program that addresses childhood illnesses. Our immunization programs are mainly focused in children. We do not have a strong vaccination program for adolescents and adults. So as we develop these vaccines and prepare for their rollout, we need to start thinking now, what kind of delivery systems do we need to put it in place so that we can be able to reach the adolescent and adults that need this vaccine as soon as possible, and also to make it convenient for them to access the vaccine. So some of the work that we'll be doing is to gather opinions of policymakers, healthcare providers, as well as community. So what be accessible, what will be easiest to
Now, Dr.
roll out
Lebina,
a vaccine for adolescents.
your line is
and
not the best,
adults.
but before your line cuts off, maybe let me just squeeze in this question. The minister also suggested that the TB vaccine will boost the fight against HIV. But then in practical terms, how will the TB vaccination impact HIV positive populations, particularly in those regions with the high core infection rates?
Some of the challenges of living with HIV is that the immune system is weakened. You are unable to fight infections, including TB. So if you are living with HIV, you are at higher risk of developing a TB infection. Therefore, if we have a vaccine, that means we are reducing the risk of acquiring TB in people living with HIV as well. So that just reduces some of the challenges they need to deal with, improving their overall quality of life.
All right, Dr. Lebina, great chatting to you. Thank you so much for joining us. If we had more time, maybe we could have touched on, one of the key areas, having reliable delivery systems for the vaccine. But thank you so much for joining us this evening.
Thank you.